Hi, I'm Joanne Levin, and Johnny and I took the HATD study tour in 2018. And it was an amazing experience, a fabulous trip and really eye-opening. So there were about 23 of us on this trip, and we shared a bus, and every day we climbed into that bus and went to various grantees, sometimes one a day, sometimes two a day, and sometimes with a speaker in the middle of the day. It was very packed and busy and interesting. We would go to the organizations that are supported by HATD, and the leaders of those organizations would explain to us what their work was. And sometimes the individuals who benefited from that work were also joining us and telling us their personal experience. And it became very clear that people's lives were being changed by this work. Before going on this trip, I guess I thought about Israel and Palestine based on the politics. It seemed hopeless, but at least after this trip, I had more faith in individuals helping each other. And as a doctor, it also was heartening to see that people could improve their health and improve their lives with the help of this organization and each other.
One of the things that I learned from this trip was that I'd sort of thought of this as a divide between two groups of people, excuse me. And I just began to appreciate more and more the nuance of how many different people and different aspects of their lives were affected. And I've thought of hope as sort of a big picture hope. But I think what I learned from Healing Across the Divide is that hope is something that can fuel many, many small communities and individuals to help determine their own future, to be more engaged in their own health and in the health of their children and grandchildren.